ট-ইনট
physician is solving is the access to ICU care for patients in remote parts of the world. What we do at Cloud Physician is using our technology and our services, our specialist doctors in ICU medicine are able to reach patients in remote areas where critical care access and critical care expertise is rare. India has more than 3 lakh ICU beds and only about 4,500 trained ICU specialists. So there is a massive gap in the service of critically ill patients across the country. This was true before COVID, and COVID acted as a stress test and actually uncovered this shortage to an even greater degree. This is where our framework allows our doctors based in care centers in Bangalore to reach out to patients in remote parts such as Leh, Ladakh, Kachar district in Assam, areas in rural parts of Maharashtra. We have supported the government in its COVID initiative as well, taking care of patients in government hospitals in Karnataka, Maharashtra, Leh and Kerala, using the same framework. What we have demonstrated is the ability to help patients no matter where they are in terms of geography and give them the best critical care expertise that they require when they are the most vulnerable. In our partnership with Medica, we are able to enhance that vision and mission statement even further. Medica is a serious player in the field of critical care and a leader in healthcare services in the eastern parts of the country. And our vision is very closely aligned because the state-of-the-art critical care expertise that the Medica doctors have in a major town like Calcutta should reach across the region. And using our technology, they will be able to achieve the same, and that is the focus of this partnership. The focus is to make sure that patients in remote parts of the region get the same expertise, the same care that they would get in metro cities. Democratizing access to critical care is what this partnership will make a reality. Thank you.
I also trained abroad. I actually trained in Philadelphia for my critical care training and internal medicine, and then I came back to India. Then we also had COVID. We are also able to provide care in the United States with electronically. Why is this? It is because entire patient medical record is digitized. There is no information that I have that the patient at the bedside does not have. And if I have a camera system and if I have a doctor who is next to the patient, it does not matter where the specialist is, the brain is. Think of it like this, your brain is over here, but your brain knows what your finger is feeling. Is your brain finger feeling hot, cold, pressure, correct? Is it feeling pain? The same way, there is no reason. You do not need the brain to be at the location of the sense organs. This is what a good software system provides for you. And this is why at Medica, we found a really good software system that was made by Cloud Physician. What this allows us to do, the same way we have digitized our patient records in Medica, we go to smaller hospitals in the state, Alipurduar, Kulpi, Bankura, Jayanagar, where what this allows us to do, we digitize the patient records, so we have complete access to all the patient, blood pressure, heart rate, ECG, X-ray, CT scan, blood reports, and I can see the patient physically, and I can talk to the doctor at the bedside, because like Dr. Dilip said over here, 3 lakh beds with only 4,000 critical care doctors, and it takes 11 years of training after finishing MBBS to get another critical care doctor out. So total 15 years of training including MBBS to get any critical care doctor out. This demand gap, supply demand gap will not be met anytime soon. And if the bedside hospital has a doctor there who can carry out the instructions that we have informed them, then 90% of care can be delivered. Not everybody needs dialysis, not everybody needs a ventilator. What they need is a doctor who knows what they're doing at the right time to avoid the complications so that we can avoid them going on dialysis, avoid
to remote areas of the country.
मेडिका हैज द सेम गोल्स. मेडिका का भी सेम गोल है कि पूरे ईस्ट इंडिया में जो भी क्रिटिकल केयर रिक्वायरमेंट हो वो मेडिका हॉस्पिटल का हाई लेवल आईसीयू डॉक्टर, स्पेशलिस्ट डॉक्टर, सुपर स्पेशलिस्ट डॉक्टर इस टेक्नोलॉजी को यूज करके ईस्ट इंडिया के सारे रीजन में क्रिटिकल केयर सर्विसेज पहुंचा सकते. ये मेडिका का गोल.
One thing, can I ask you one thing? Because in case of remote areas, what happens is this sometimes how sure you are, because the patient, once a patient is getting admitted in any of the remote area, what and all the technology you are having is very much appreciable. But whether that particular hospital is having that much of equipment or not.
Yes.
My question is something like this, because a question is there, it doesn't mean that each other means in modern areas, in modern hospitals, in good hospitals, what we call it. Let's say the names of America and Apollo hospitals, in any of the remote nursing homes, it might happen so the person is in a very, very critical condition. He might or she might not be getting that much of amenities or facilities what these big hospitals are getting. With the help of technology, you are going to provide the suggestions that is accepted.
Yes.
But at the same time, whether that particular amenity is to treat the patient which is there or not, my question
Very
is
good question. See, when we came back from the US, the first 2 years that we did was we traveled to about 100 ICUs in India. And we wanted to see what are the facilities available before even we can start giving the service. So we would make a checklist that you have to have power, you have to have internet, you have to have monitors, you have to have ventilator, you have to have these things. If they meet the checklist, we are ready to provide the service.
You are going to
So
make a
what
tie-up
happened?
with them.
Yes. So what interestingly happened was 95% of these hospitals already had the equipment. They were not using it. It was gathering dust because of skill and expertise. So what we discovered was getting equipment to remote regions has been almost solved. Getting a ventilator was not a problem. 40,000 ventilators were produced in the last 2 years alone. But the challenge is that 50% of those ventilators or more in the government setup are not being utilized, mainly because of an expertise crunch. For the problems we just discussed, एक डॉक्टर जो ICU स्पेशलिस्ट है उसे ट्रेन करने में 15 साल लग जाते हैं. So without that trained person, how are you going to use the ventilator? You won't be able to use it safely. So our goal is that if there are other team players who will solve the equipment problem, we are here to solve the service problem. We are here to solve the skill problem, the education problem. And combining these two is the only way the patient will see benefit. Without linking these two, the patient's outcome cannot be changed. So think of us and this partnership as the last link in the chain. You have the hospital.